Hi, I'm Patrick Perry. I'd like to show you blood test. I'd like to show you. Okay, I went to go to doctor appointment. Yeah, it's a blood test. Let me show you what my blood test is. Let me show you that is. You see right here? I got a blood test. I got a blood test right here. I got a blood test. Yeah, my brother Kenneth, he took me at a doctor appointment. I have a blood test. I got a blood test. But that is, I like to show you that is the videos. The video is called the blood test. I like to show you blood test on YouTube. I like to show you that is. I like to show you. Okay. This is just called the blood test for the videos. You may have watched this. You may have watched.
If you are watching this video, your healthcare provider has asked you or someone you know to get a blood test to measure your cholesterol levels. The National Institutes of Health Cholesterol Treatment Guidelines recommend you have a blood test every 5 years if you are 20 years or older. The test, called a fasting lipoprotein profile, measures your levels of total cholesterol, LDL, also known as bad cholesterol, HDL, also known as good cholesterol, and a type of fat in your blood called triglycerides. During this test, a blood sample will be taken after you have not eaten for 9 to 12 hours. Fasting is important to ensure accurate results for this test. The total cholesterol goal should be less than 200 milligrams per deciliter. For most people, an ideal HDL or good cholesterol should be 60 or higher. An ideal LDL or bad cholesterol should be less than 100. And fasting triglycerides should be less than 150. If you have high blood cholesterol levels, you have a greater risk of heart disease. In heart disease, blood vessels called coronary arteries become narrowed or blocked by a waxy substance containing cholesterol called plaque. Over time, plaque may reduce or block the flow of oxygen-rich blood to your heart muscle and cause a heart attack. There are many known risk factors for heart disease. Risk factors you can control include high blood cholesterol and triglycerides, high blood pressure, diabetes, prediabetes, being overweight or obese, smoking, lack of physical activity, an unhealthy diet, and stress. Risk factors you can't control include age, gender, and having a family history of heart disease. If you already have heart disease and multiple or severe risk factors, your doctor may lower your LDL goal to less than 70. Your specific goals may vary depending on your health situation. Ask your doctor what your lipid goals should be.
Okay, I'd like to show you about a blood test Wikipedia. I'd like to show you that is. I'd like to show you. Okay, here it goes. Hang on. Okay, the blood test. Let's see you read out loud now. Listen this.
Blood test. From Wikipedia, the free encyclopedia. For the novel by Jonathan Kellerman, see Blood Test, novel. Modern Hospital Hematology Laboratory. A blood test is a laboratory analysis performed on a blood sample that is usually extracted from a vein in the arm using a hypodermic needle or via finger prick. Multiple tests for specific blood components, such as a glucose test or a cholesterol test, are often grouped together into one test panel called a blood panel or blood work. Blood tests are often used in healthcare to determine physiological and biochemical states, such as disease, mineral content, pharmaceutical drug effectiveness, and organ function. Typical clinical blood panels include a basic metabolic panel or a complete blood count. Blood tests are also used in drug tests to detect drug abuse. Contents: 1. Extraction. 2 types of tests. 2.1 Biochemical analysis. 2.1.1 Normal ranges. 2.1.2 Common abbreviations. 2.2 Molecular profiles. 2.3 Cellular evaluation. 3 Future alternatives. 3.1 Saliva tests. 3.2 Microemulsion. 3.3 Symbis. For see also. 5 References. Extraction, edit. A venipuncture performed using a vacutainer. A venipuncture is useful as it is a minimally invasive way to obtain cells and extracellular fluid, plasma, from the body for analysis. Blood flows throughout the body, acting as a medium that provides oxygen and nutrients to tissues and carries waste products back to the excretory systems for disposal. Consequently, the state of the bloodstream affects or is affected by many medical conditions. For these reasons, blood tests are the most commonly performed medical tests. 1. If only a few drops of blood are needed, a finger stick is performed instead of a venipuncture. 2. Indwelling arterial, central venous, and peripheral venous lines can also be used to draw blood. 3. Phlebotomists, laboratory practitioners, and nurses are those in charge of extracting blood from a patient. However, in special circumstances and emergency situations, paramedics and physicians extract the blood. Also, respiratory therapists are trained to extract arterial blood to examine arterial blood gases. 4. 5. Types of tests, edit. Vacutainer tubes used in the collection of blood. During venipuncture, pressure differences between the vein and the vacuum in the vacutainer forces blood into the tube. Biochemical analysis, edit. A basic metabolic panel measures sodium, potassium, chloride, bicarbonate, blood urea nitrogen, BUN, magnesium, creatinine, glucose, and sometimes calcium. Tests that focus on cholesterol levels can determine LDL and HDL cholesterol levels, as well as triglyceride levels. 6. Some tests, such as those that measure glucose or a lipid profile, require fasting or no food consumption, 8 to 12 hours prior to the drawing of the blood sample. 7. For the majority of tests, blood is usually obtained from the patient's vein. Other specialized tests, such as the arterial blood gas test, require blood extracted from an artery. Blood gas analysis of arterial blood is primarily used to monitor carbon dioxide and oxygen levels related to pulmonary function, but is also used to measure blood pH and bicarbonate levels for certain metabolic conditions. 8. While the regular glucose test is taken at a certain point in time, the glucose tolerance test involves repeated testing to determine the rate at which glucose is processed by the body. 9. Normal ranges, edit. Main article, reference ranges for blood tests. Blood tests results should always be interpreted using the ranges provided by the laboratory that performed the test. Example ranges are shown below. Test 10, 11. Low. High. Unit. Comments. Sodium, Na. 134. 145. Mol/L. Potassium, K. 3.5. 5.0. Mol/L. Urea. 2.5. 6.4. Mol/L. Blood urea nitrogen. Urea. 15. 40. mg/dl. Creatinine male. 62. 115. Mol/L. Creatinine female. 53. 97. Mol/L. Creatinine male. 0.7. 1.3. mg/dl. Creatinine female. 0.6. 1.2. mg/dl. Glucose, fasting. 3.9. 5.8. Mol/L. See also glycated hemoglobin. Glucose, fasting. 70. 120. mg/dl. Common abbreviations, edit. Upon completion of a blood test analysis, patients may receive a report with blood test abbreviations. Examples of common blood test abbreviations are shown below. Abbreviation 1213 stands for Description. HDL. High density lipoprotein. Level of good cholesterol in the blood, ratio of HDL. LDL is usually more significant than actual values. LDL. Low density lipoprotein. Level of bad cholesterol in the blood, ratio of HDL. LDL is usually more significant than actual values. PV. Plasma viscosity. Plasma viscometry, PV, is the measurement of the viscosity of blood plasma. The end result is a number given in millipascal seconds, m.pa.s, known as the PV, or plasma viscosity. CRP. C-reactive protein. Level of inflammation with the body. If the immune system is fighting an infection or illness, CRP will be higher. CBC. UK, FBC. Complete blood count. UK, full blood count. Analysis of 15 different blood test readings to provide information about overall health. TSH. Thyroid stimulating hormone. Thyroid regulates the function of metabolism. Low levels can lead to weight loss, while high levels lead to weight gain. PTH. Parathyroid hormone. Regulates serum calcium. ESR. Erythrocyte sedimentation rate. Indicates the time it takes for red blood cells to move down a tube. This shows signs of inflammation within a body. INR. International Normalized Ratio. This is a blood clotting test. LFT. Liver function test. This test reveals the levels of waste products, enzymes, and proteins that are processed by the liver. U+E. Urea and electrolytes. This test is performed to measure the function of kidney. CMP. Comprehensive Metabolic Panel. This analysis provides an overall picture of the metabolism and chemical balance of the body. WBC. White blood cell count. The level of white blood cells. RBC. Red blood cell count. The level of red blood cells. HBC. Hemoglobin. Level of hemoglobin molecules. HCT. Hematocrit. similar to RBC but in percentage. PLT. Platelets. Platelets levels in the blood. Molecular profiles, edit. Protein electrophoresis, general technique, not a specific test. Western blot, general technique, not a specific test. Liver function tests. Polymerase chain reaction, DNA. DNA profiling is today possible with even very small quantities of blood. This is commonly used in forensic science, but is now also part of the diagnostic process of many disorders. Northern blot, RNA. Sexually transmitted diseases. Cellular evaluation, edit. Full blood count or complete blood count. Hematocrit. MCV, mean corpuscular volume. Mean corpuscular hemoglobin concentration, MCHC. Erythrocyte sedimentation rate, ESR. Cross-matching. Determination of blood type for blood transfusion or transplants. Blood cultures are commonly taken if infection is suspected. Positive cultures and resulting sensitivity results are often useful in guiding medical treatment. Future alternatives, edit. Saliva tests, edit. In 2008, scientists announced that the more cost-effective saliva testing could eventually replace some blood tests, as saliva contains 20% of the proteins found in blood. 14. Saliva testing may not be appropriate or available for all markers. For example, lipid levels can't be measured with saliva testing. Microemulsion, edit. In February 2011, Canadian researchers at the University of Calgary's Schulich School of Engineering announced a microchip for blood tests. Dubbed a microemulsion, a droplet of blood captured inside a layer of another substance. It can control the exact size and spacing of the droplets. The new test could improve the efficiency, accuracy, and speed of laboratory tests, while also doing it cheaply. 15. The microchip costs $25, whereas the robotic dispensers currently in use cost around $10,000. Citation needed. Symbis, edit. In March 2011, a team of researchers from UC Berkeley, DCU, and University of Valparaiso have developed lab-on-a-chip that can diagnose diseases within 10 minutes without the use of external tubing and extra components. It is called Self-Powered Integrated Microfluidic Blood Analysis System, SYMBIS. It uses tiny trenches to separate blood cells from plasma. 99% of blood cells were captured during experiments. Researchers used plastic components to reduce manufacturing costs. 16, 17. See also, edit. Biomarker, medicine, a protein or other biomolecule measured in a blood test. Blood film, a way to look at blood cells under a microscope. Blood lead level. Hematology, the study of blood. Luminol, a visual test for blood left at crime scenes. Shum test, a common test for blood mismatch. Barbro-Hjalmarsson. Blood gas test. Tumor marker cancer assay.
Well, who like my videos? Hope you like it. Well, maybe that's it.